Is your breast implant hard as a rock and do you have pain from your breast implants? Well, then you have grade 4 capsular contracture. According to the textbook, capsular contracture is the most common complication occurring in breast enlargement surgery, with over 50% of patients having occurrence. The body's natural response to any foreign body like a breast implant is to encapsulate it in scar. Capsular contracture is when that scar thickens to the point that it distorts the breast implant shape, causes a deformity or pain. This is a natural process that typically progresses more so with time. The current classification system that we use is the Baker's classification system for capsular contracture. Dr. Baker published his capsular contracture classification scale in 1978, and basically it goes like this. A grade 1 Baker capsule is soft and the implant is non-visible. It feels natural and you can't really tell easily that the patient has breast implants. A Baker 2 classification, the capsule started to get a little firm and hard, and the breast implant feels hard, but you cannot visibly see a deformity. A Baker 3 capsular contracture, now it's starting to get hard enough that there's a deformity, and you can actually see the capsular contracture when looking at the patient visually. A grade 4 capsular contracture now has all those problems, but pain has started. So it can be very deformed and distorted, but what you really see is that it's firm and painful. So pain is what separates a grade 4 capsular contracture from a Baker grade 3 capsular contracture. Some have considered the Baker's classification system to be subjective, and 45 years have gone by. Multiple other capsular contracture classification systems have been proposed. But the Baker system is still the international standard that's considered by both plastic surgeons and also insurance companies when looking at the degree of capsular contracture in a patient. Now, why does it happen? There are multiple theories on why capsular contracture occurs. And some of these include foreign body reaction, the leakage of silicone through the implant shell into the capsule, low-grade bacterial or yeast infection that's colonized the implant, contamination, small amounts of blood around the implant, or a potential autoimmune disorder or a genetic predisposition to form bad capsules. One classic paper showed over a 20% risk of severe capsular contracture by 13 years in saline breast implants. Historically, the older silicone breast implants had a higher rate, but the new generation silicone implants are supposed to be similar or less. Calcifications can occur in both saline and silicone breast implant capsules. Calcifications are usually rare prior to 10 years, but one study showed over 100% of capsules had calcifications after 23 years. These older implants with severe capsular contracture can look really crazy when we remove them, and it looks like eggshells, or sometimes I call it sidewalk chalk. What's interesting is that some soft capsules can still have strong contractures and pull, creating pain and deformity. Some Baker grade 4 capsular contractures are softer than others. Once capsular contracture occurs, it can be really hard to treat it and make sure that it doesn't come back when a patient wants implants replaced. Some studies have shown up to and over 50% recurrence of capsular contracture, regardless of whether the capsule is removed completely or it is released surgically in parts. If you're concerned that you have capsular contracture and you want to seek treatment, see a board-certified plastic surgeon who can discuss your options, including implant removal or implant replacement. Because you do have options, but you need to know the risks and benefits of each.